My name is Tom, and this is my assistant Tom, and we're working on a routine trach change for Mrs. Smith. Orders are after difficult intubation to please change to a number 6 cuffless, so we're changing from a cuff to a cuffless per routine trach change policy. Orders are to suction PRN, but the patient does not need suctioning today. Patient's on a 40% trach collar. Sats are at 98%. Can Mrs. Smith be weaned? Well, we might be able to wean her since we're going from a cuff to a cuffless. And that's one of the ways you would wean her. The next way would be to use a fenestrated trach. So let's get busy. I'm going to go ahead and wash my hands and glove up. Now this is a sterile procedure, so I'm going to go ahead and don the regular gloves. As well as I'm going to wear a sterile glove on my dominant hand, my right hand. And if I could just learn how. All right. So first part of this procedure is to go ahead and put now my sterile glove on my dominant hand, being careful not to touch the outside of the glove. All right, so I'm going to go ahead and create a sterile fill here. I'm going to go ahead and dump the contents of the new cannula out, and being careful not to only touch the flange. I'm going to go ahead and check that the obturator, the inner cannula will insert and click into place. As it does, then I will remove the inner cannula, then I'll insert the obturator in. So this is all ready to go. I'll set that aside on my sterile fill. Now I'm going to ask my assistant to go ahead and oxygenate for 2 minutes before we proceed. Okay, 2 minutes have elapsed. I'll go ahead and put that on back on. And now I'm going to ask my assistant to deflate the cuff. Thank you. Cuff deflated. I'm going to set aside the collar. I'm going to go ahead and with my sterile hand, with my unsterile hand, I'm going to go ahead and remove the straps. Go ahead and gently remove the inner cannula. I'm going to set that aside. Go ahead and remove the trach collar gently. Yep, popped right out. And immediately I want to go ahead and, with the obturator in the new, go ahead and insert that. Once the new tube is in, I want to go ahead and remove the obturator and insert the inner cannula and go ahead and apply new dressing. Now I'm not going to be cleaning the trach today, I'm just changing it. And once that's done, go ahead and place the strap back on, the ties, and I want to go ahead and get the gentleman on 40% oxygen right away with the collar. You can tell if the straps are tight enough should be 1 finger snug, or 2 finger snug, 1 finger a little less snug, so that feels like a good fit. All right, I'm all done with that. So we're done with the procedure. I'm going to check once the new tube is placed, we do want to check the patient's vitals, including breath sounds, that will confirm that the trach is in the right place, positioned. Check his end tidal, make sure we're getting a good carbon dioxide reading. We want to clean up the area, and then, as I said before, chart. If there is excessive bleeding, we do want to report that to the RN. Make sure that the patient is still satting. He's still satting at 98%. And I'm going to go ahead and remove my gloves and chart.